Hey guys, it's Jay and I'm back again today with another video. Again, I'd like to welcome you to my channel, Respiratory Therapy Essentials for the TMC exam. Now, we are moving on, we are moving good, and I certainly hope that you get aboard because on this channel, all we talk about is content to help you pass the TMC exam on your very next attempt. Now, tonight, we're talking about modifying mechanical ventilation mode, one of the most important subjects that you will have on this exam. Now, without any further ado, let's get busy. Modifying mechanical ventilation mode is one of the most important things that you will see on this exam. I have some very important information, some very important tips on the board behind me that you will see again for this exam. All right, let's start. Roman number 1. For the TMC exam, you will have to modify the mode. Now, modifying the mode is not putting the patient on the ventilator for the first time. Make sure you understand that. This is once you have the patient on the ventilator. Now, the best mode is SIMV because it allows the patient to take a breath on their own. And I'm going to sound repetitive on this matter because it is what you're going to see on the exam. The next best mode is assist control. And the next best mode is pressure control. Now, when we talk about pressure control, we're talking about our patients have now developed stiff lung, or you have a PIP, peak inspiratory pressure, of 50 centimeters of water, while the plateau pressure is headed toward 30 and 35. Now we have a change in compliance. Therefore, we don't want to use SIMV or assist control. Now we want to put the patient on pressure control. Keyword here is stiff lung and high PIP. Now, the reason to change mode from AC or SIMV to pressure control, again, lungs are stiff, peak pressure around 50 centimeters of water due to increase in the plateau pressure. If high PEEP are due to secretion in the airway or bronchial restriction, or just because the patient is bited on the ET tube, this is no reason to change to pressure control. Not for these reasons. Because for secretions in the airway and bronchial constriction or biting the tube, all we have to do is suction the patient or give a bronchodilator or sedate them. We don't just change them to pressure control. But if the lungs are stiff for any other reason, especially look at your PIP and your plateau pressures, and that would help you decide whether or not you need to just suction the patient or give them a bronchodilator. Now, you will change from assist control to SIMV mode when the patient is bucking the ventilator. They become alert and it's uncomfortable. If your patient is on assist control and you want to go to SIMV, when they start bucking the ventilator or when they're ready to be liberated or when you know sedation is being DC'd on this patient. We want to put them on SIMV because it's more comfortable. SIMV allows them to breathe on their own, and that's comfortable to them. Enrollment number 2, we'll talk about pressure control and when it is used. Pressure control is used when the PIP pressure, again, is above 50, plateau pressure approaching 35, decrease in lung compliance, persistent hypoxemia, and to reduce barrel trauma. These are the reasons why we use pressure controlled ventilation. On this exam, you may have to put a patient on APRV or IPPV, and these modes are used to improve oxygenation, such as a patient with ARS or a patient with severe restrictive diseases, pulmonary fibrosis. APRV is another mode that you may see on this exam. If you use APRV, make sure you use it early. Don't wait the patient has been ill 4, 5, 6 days and then you want to put them on APRV. No, you want to put them on there early if you can recognize the problem because it gives continuous airway pressure. Then it falls to a preset level. Patients that benefit from APRV for the exam are patients with acute lung injuries, ARDS, atelectasis, pneumonia, tracheoesophageal fistula. These people can benefit from the APRV mode. So don't shy away from this mode on the exam if you see it. APRV also improve alveolar recruitment and improve gas exchange distribution at the alveolar level. That's very important, especially for this exam. Roman number 3, we have high frequency ventilation and high frequency oscillating ventilation used for patients with ARDS or decreased compliance problem. And when we say decreased compliance problem, we mean bronchopulmonary fistula, bronchoscopy. You can use this mode done for bronchoscopy. People on the ventilator can be bronch. Excessive bubbling in the chest tube because there has been a perforation of lung tissue. Use HFOV. Now, patient ventilator dysynchrony. You can also use this mode, but this usually happens when the patient is awake. So we will use our best mode. When patients are awakening, we use our best mode because this assists them and allows them to breathe on their own. SIMV and assist control. SIMV is also used when the patient who are sedated are expected to awaken. They may be on sedation holiday. You know, we don't stand there at their bedside 24 hours a day. However, as the sedation wears off, SIMV allows them to take a breath on their own until that sedation wears off. Newsflash, you will have to modify modes of ventilation on this exam. Remember, the SIMV is our best mode. Our next best mode is assist control, and then we have pressure control, usually because of decrease in patient compliance. Do not shy away from the modes that I have listed on this board because you're not that familiar with them. RV, APRV, and high frequency ventilation you will see on this exam. So I ask that you will study wisely. Patient ventilator dysynchrony absolutely will be on this test. Know all that you need to know about it. And there you have it. Okay, guys, I'm back. Hey, listen, on this exam, you will have to modify mechanical ventilation mode. The thing that we're talking about are not for the initiation of mechanical ventilation, but modifying the mode once the patient is on the ventilator. Hey, guys, I appreciate you, and I thank all of you who tune in and who have subscribed to my channel. Do me a favor, hit that like button, subscribe to my channel, turn on the post notification bell because we giving 1 or 2 videos every week concerning respiratory essential for the TMC exam. And until next time, we out.